Good afternoon, everyone. This is Timothy McHugh, Director of Grant Programs of the Potomac Health Foundation. We're going to get started with our request for application information webinar. This is for our 2019-2020 Howard L. Greenhouse Large Grant Program. Thank you, everyone, for joining us today on this webinar. With me today is my fellow colleague, Kukwa Osei-Gyamfi. Our Executive Director, Susie Lee, is still on holiday for vacation and will be returning to the office soon. While you've had the 2019 request for LOIs for a few weeks now, today's webinar is really an opportunity to dive deeper into the types of projects the Potomac Health Foundation might be looking for this round of grant funding, and, more importantly, to answer questions you might have on the call for LOIs in the process itself. If you haven't already, please take a moment to familiarize yourself with the WebEx platform. All participants on the call are on mute and will be until we open for questions later on, which we prefer over the question and chat section of WebEx. Please be sure to use that feature to connect with Kukwa and I throughout the webinar with your questions. As a reminder, today we will only be discussing the new requests for LOIs. Those in our mental health cohort and our large grant program will receive information on continuation application processes in the coming weeks. Again this year, current grantees are eligible to present one additional letter of intent for a new project if you decide to do so. As you know, Potomac Health Foundation is about halfway through our 2017 to 2020 strategic plan, which, as you see on the slide, positions the foundation to focus on capacity building, access to health care, and mental health, including substance abuse. Part of the current Potomac Health Foundation strategic plan was to move the foundation to more of a directed grantmaker approach rather than a responsive one. What exactly does being a directed grantmaker mean? For Potomac Health Foundation, our shift to directed grantmaking has meant concentrating our efforts to a more narrow set of focuses. Again, access to health, mental health, and capacity building. It means going deep on those topics and investing heavily in them to try and have a larger impact. Being a directed grantmaker has also meant rethinking how we engage and interact with our grantees and how they interact with each other. Last year, with the support of our consultants at Community Health Solutions, we assembled our mental health cohort of grantees. The cohort has a quarterly convening, an online portal, and access to consultants for support on evaluation and other project needs. So far, the dialogues that have occurred through the cohort have informed both participants and the foundation. Potomac Health Foundation is excited to gather the cohort together again this month and will consider assembling similar cohorts based on focus areas depending on the portfolio of grantees. This year's RFA focuses on access to health and capacity building and will allocate almost $2 million to projects. So, what exactly are we looking for? Under Access to Health, Potomac Health Foundation seeks projects that focus on Medicaid expansion, improving access to health care, and on the social determinants of health. Let's dive deeper on the kinds of projects around access to health and then move on to capacity building. As we go through the next few slides, please recall that this information is presented as including but not limited to. This is not the full extent of all types of projects around access to health or capacity building that the foundation would consider this cycle. As you know, Virginia recently expanded Medicaid. It is estimated that 400,000 in Virginia would be newly income eligible for Medicaid under the new rules. There is a need to identify and enroll these individuals, and the foundation is supporting these efforts through this RFP. The opportunity to outreach to and support the eligible population with their enrollment is an ongoing opportunity. Targeted awareness to the community to engage the Medicaid expansion eligible population is a priority. From community events to marketing and social media, getting the message out on an ongoing basis is all crucial. Once you've engaged the audience, assisting them in enrollment is the next pivotal step. From enrollment assisters to community health workers, the Foundation could support staffing and/or training of these types of roles in your organization. Finally, Medicaid expansion might have significant impact on your organization. Some free clinics are even opting to become hybrid clinics so they can begin billing Medicaid. Any related outside expertise of consultants or technical assisters is also something able to be presented in an LOI this cycle. Improving access to health care. What does improving access project look like? Projects can be focused internally within your organization, across the community between 2 or more partners to improve access to care, or focus on local, regional, or statewide policy that will increase access to care. Some possible examples: the hiring of providers, specialty care or case managers, and related positions that promote increasing access to care. Coordinating efforts for warm handoffs, referral systems, centralized intake are all projects of interest. Lastly, efforts to promote advocacy for issues and policies that promote access to care are also important. For instance, faith-based outreach played a pivotal role in the efforts that led to the passing of Medicaid expansion in Virginia. While expansion is a great win, there are other policies to advocate for in order for the health care system to be more equitable and have better access for those in need. Social determinants of health. Social determinants of health are the community, environmental, and social factors that inhibit or promote health, physical activity, mental health, proper nutrition, and more. So what is the Foundation looking for? Upstream projects help put a halt on health inequities that still exist in our world today. Affordable housing and housing solutions for low-income families and individuals, efforts to eliminate transportation barriers for the medically underserved, and access to fresh and nutritious food through markets, prescription programs, and other models. The Robert Wood Johnson Foundation has an elegant definition for health equity. To them, health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health such as poverty, discrimination, and their consequences, including powerlessness and a lack of access to good jobs with fair pay, quality education and housing, safe environments, and health care. As you may be aware, Potomac Health Foundation and other community partners have been learning about health equity over the past year, and specifically on the role of racism in health equity and the contribution varying levels of racism has had on preventing certain segments of the population from having a fair opportunity to be as healthy as possible. Ultimately, it would be great for us all to use health equity as a lens through which all of our work should be conducted. And the question to ask ourselves when we do our work is, how is our project going to help ensure that the target population has equitable access to good health outcomes? How has racism affected health outcomes and how people have experienced social determinants of health in their lives? We understand this is an ongoing journey on a difficult and complicated topic, so please feel free to reach out to the Foundation staff if you would like to discuss this more. As a foundation, we wanted to be sure that we were following up concretely on the learning we started earlier last year around racism and health equity by making resources available for this type of work. Lastly, have you always wanted to partner with a non-traditional partner on health intervention in your community? Is there an exciting tech company with a great solution for improved health outcomes? Or an arts or culture organization that does arts or music therapy? The partnerships and possibilities are really limitless, and we look forward to seeing them in your LOIs. I'm going to pause for just a moment and see if we have any questions so far. Kukla, if you could also check for any questions. We'll move on to capacity building in just a moment. I don't see any questions so far, but keep them coming in when you do have them, and we'll move on to capacity building. Potomac Health Foundation has made a pivot in how we support capacity building by building on strategic partnerships with thought leaders like Board Source and Center for Nonprofit Advancement, keeping in mind that grants made this cycle are not to be duplicative of the programs offered by the current body of Potomac Health Foundation capacity building partners. The Foundation is aware that organizations may sometimes need direct support for capacity building efforts. This is a bit of an expansion of the Management Assistance Project funding that was available in the past. Does your coalition need a facilitator, a strategic plan, or an evaluator? Does your big initiative need marketing and communications? Does your IT need an upgrade? All of these are potential projects that you could present in your LOI. Again, remember that the examples shared in the previous slides are just ideas and examples. They are projects the Foundation might possibly like to see and or recognize are going on in the county and nearby jurisdictions. So use these examples as a starting point. We'll talk about our office hours in just a few, and that's another great chance to discuss your project ideas with the Foundation staff. It's important to move on to some fine print within the RFP. Again, this year, we'll be giving preference and special consideration for submissions that are joint efforts between 2 or more partners, structured for decreased dependence on Foundation funds, evidence-based and culturally competent practices, and those that use a racial equity lens in provision of services. Again, the Foundation is able to give preference and special consideration to the criteria as described on this slide. For instance, if deciding between 2 similar projects, the one with a stronger sustainability plan and or would be a joint effort between 2 or more partners could receive a preferential scoring. Please keep this in mind as you design your projects and compose your LOIs. Some other pertinent information. Again, the grant range this year is between $25,000 and $250,000. Grants cannot be requested fewer than $25,000 through this RFI. With almost $2 million budgeted for this cycle, the number of grants could be as few as 8 or many more depending on the size of the requests that come in. Please note that organizations can only submit 1 letter of inquiry for which you are the lead agency or host. Agencies may be a named partner or subcontractor for 1 additional LOI. Finally, please be sure to not just ask for everything in the kitchen sink and to be ready to present thoughtful and articulate projects. So the process. The process will occur in 2 steps. A letter of intent, which is due by 5 p.m. on January 25th, and a full proposal, if invited, would be due by 5 p.m. on April 13th. Please note that a site visit to your organization may be required in between those 2 steps, and we would notify those agencies along the process. Here are some important evaluation criteria. In addition to the types of access to health and capacity building projects sought, the Foundation will favor those projects that show promise of significant impact in addressing identified issues, are clearly aligned with Foundation priorities, demonstrate sound financial planning, including sustainability, are thoughtfully planned, organized, and ready for implementation, and complement efforts of other organizations and address current and emerging health issues. Specifically, the following evaluation criteria will be considered through the due diligence process as the Foundation works to identify the request to fund: the geographic service area, alignment with strategic priority areas, the target population in filling critical needs, the methods and activities and use of best practices, the appropriateness of budget request, organizational ability, and whether or not the project meets board-approved grant guidelines. Please note that these evaluation criteria are considered when selecting which LOIs move from LOI to full proposal and which receive ultimate funding. The Foundation service area. Applications will be accepted from tax-exempt organizations to serve the people of eastern Prince William County and the immediate adjacent communities in southeastern Fairfax and North Stafford counties. Organizations may be headquartered in other parts of the Commonwealth or region. For those agencies, you must be able to clearly delineate how the Foundation's catchment area will benefit from the work of your grant. The fine print. The Foundation excludes the following from funding consideration: programs not directly related to health, sponsorships including fundraising events, direct support of individuals, programs designed to serve members of religious or sectarian organizations exclusively, programs currently served by other sources if the Foundation would supplant this funding, the retirement of debt, programs that do not or would not have other sources of revenue, as of a couple years ago, or explicit policies that we cannot be the sole source of funding, scientific research grants, indirect cost percentages, and again, we cannot be the sole funder on any projects. A note on sponsorships. Please refer to our website on the Foundation's latest policies and opportunities around sponsorships, should you have that type of request or need in the coming months. We recently updated that policy under our new discretionary grant process. Next steps. As of this webinar, 3 slots are still available on Tuesday, January 8th or Thursday, January 10th for our office hours, which are meetings held via in-person or telephone, half hour with myself and Kukwa to discuss your potential projects. To based on demand after today's webinar, additional slots may open up for Friday, January 11th, once those last 3 slots on Tuesday and Thursday of next week have been reserved. I encourage you to please keep checking the doodle poll link provided in this slide and within the RFP for future availability as more slots are needed and opened up. A couple notes on the LOI guidelines. Again, all LOIs will be completed in fondant and will not exceed 2,500 characters. Sections include the agency profile, project information, project narrative, a proposal budget, and signatory page. Please note that while in fondant, each question prompt has a specific character limit. To note again, these are character limits, not words. You may want to type up your LOI in a word processing program to use a character count and then transfer and copy and paste it over into fondant. Some important dates to remember. Again, right now, our office hours with staff are open up for January 8th and 10th. Other slots may become available based on demand and need. The letter of intent is due by January 25th by 5 p.m. Applicants whose LOIs will be moving forward to the full proposal process will be invited by March 8th. The proposal would be due, if invited, on April 13th by 5 p.m. Proposal applicants who are funded will be notified on June 7th. And we have an orientation that's required if you are funded on June 19th. And the project start date is July 1st for a grant term that would run July 1st of 2019 to June 30th of 2020. Please note that all deadlines are hard deadlines, and access to fondant is cut off after 5 p.m. on those days. So, questions? Give me a moment here while we get to the chat box. This webinar has been recorded, and we will be posting it on our website, and we will also be sending out the copy of the slides presented today to those in attendance as well as publishing the slides on our site. We are still waiting for any questions that may be coming in. Again, you want to put those questions in the chat box, and Kukwa and I will receive them. Well, I don't see any questions coming in just yet.
There's one.
Okay, go ahead, Google.
Okay, so hi everyone. For capacity building grants, if you're based in D.C. and serve a variety of areas, in addition to those of interest to you, can the capacity building efforts benefit the whole org, or is it just in the preferred zip codes?
I think that it's really a both. We have, for instance, we work with Voices for Virginia's Children on capacity building work around advocacy and policy, and their work is benefiting the entire populace of the Commonwealth of Virginia, but they are able to clearly delineate how the different programs and trainings offered and legislations that have been passed because of their advocacy work have and will be able to benefit those populations in Prince William County and our nearby jurisdictions that are in our catchment area. So yes, agencies that are doing regional work are certainly welcome and able to apply. You just need to be able to clearly articulate and tell the story about how that work improves the lives or the nonprofits or the policies and the people of the Foundation's catchment area. If we're happy to talk through those project ideas with you, just reach out to the staff. We have another question, a couple questions coming in. I'm going to take them in the order that they have been received. Should these projects be viewed as 1-year or 3-year projects? I'm going to be a little vague on that answer. All I can really say is that as stated in our earlier slides, this strategic planning period goes through the calendar year of 2020. So any projects that we begin funding in this year, the renewal period would fall within that. We'd be having the renewal conversations this time next year, and our plan goes to the end of 2020. There is a plan to revise and look at our plan, again, through a to-be-determined process to make sure we're on the right track or not. So look at this as 1-ish years, but we'll cross those bridges because we honestly don't know until we begin to look at that plan and begin to evaluate it further. We have another question. We are considering including a participatory research component for the advocacy portion of our proposal. Is this type of activity considered for funding? Findings would complement the funded assessment, focus on needs and priorities for the non-citizen community of the region. Yes, I think that would fit. I don't think that that's the exact type of research that we have in our excluded practices. I think that we were thinking more, clinical and research-based scientific projects that are on that excluded list. I think we have a couple more questions. Does it matter what organization is the lead if doing a collaborative project? I would think of a couple things in response to that question. I would think about tipping. Some of our grantees that will be presenting LOIs through this process already have grants with our foundation through other projects such as our safety net funding or a mental health grant or other opportunities. So that would be one factor I would consider, whether or not that partner has another grant and whether or not they should be the lead or just a subcontractor or partner. I would think about the agency that has the capacity to manage the grant, write the reports, has the staffing capacity or just general agency infrastructure to support it. And yeah, we're happy to also answer those questions. If you are planning on coming to the office hours, you can bring both partners and we can kind of talk through which makes the most sense. But that's a great question. Someone has asked, what is tipping? So there are IRS websites that help to determine whether or not your agency is being tipped. Long of the story short is If you have any one funder, individual donor, foundation, corporate partner that is providing a majority of your funding in your budget is not your revenue, is not from a diverse pool, that does then become tipping, and there are IRS ramifications and repercussions that are associated when an agency is being tipped. So I would encourage you to research through the IRS website and other nonprofit arms and whatnot a little bit more about tipping to make sure that not only in our case but in others you're not maximizing or reaching that threshold. Can that LOI include multiple? Oh, go ahead, Kukwa.
I have two questions, actually. The first question is, can the LOI include multiple projects or a single project?
That's a great question. I think that what we are looking for are thoughtful projects. If that includes a capacity building piece and it may include a clinical piece, as long as they are intertwined and complement each other, I think we would entertain that. As I said in the earlier slides, we don't just really want an LOI that has everything in the kitchen sink, everything that an agency is going to need for 2019. We don't just want that cobbled together. We want and are seeking clear, thoughtful, articulate projects that can be evaluated and monitored moving forward.
The other question that I have here is, in the RFP, mental health projects were discouraged from applying for fundings for this cycle. Does mental health projects include substance abuse disorders?
So in general, our mental health portfolio and definition within the strategic plan does include substance abuse. The foundation feels that the mental health cohort, which has been established and has around 18 community partners and grants within that portfolio, is kind of saturated at the moment. And because of the work that the cohort began in their September gathering and will continue and move forward on in their January meeting, we're not really ready to introduce a new set of mental health projects and partners into that cohort just yet. That's why we are explicit in saying that mental health projects in this RFP are not really to be presented and would not be considered, that our focus is on access to health and capacity building. Did you have any other questions come up, Kukwa? Because I have another one here too.
No, I don't have a private question.
Okay. So we have the question as to, does the exclusion of indirect cost percentages mean that you cannot include direct costs in the budget proposal? No, that's not what that means. So what we mean is that many times large institutions, hospitals, universities, and the such have a mandatory X number percent of a grant request that has to be added on to cover the cost of the indirects. We don't entertain those types of percentages, nor does the foundation say that we are only able to cover up to 5 or 7 or 19, whatever percent some other foundations and our peers would offer. What we do say is that within your budget, in your full proposal, you can include line items for staffing, for facilities, for utilities, for insurance and benefits and travel and all of those costs, but we just do not offer a direct guidance on the percentage, and or we don't honor those percentages when placed upon the foundation or the grant request from an institution. But yes, you can include the general operating type of costs, again, travel, insurance, staffing, utilities, and the such within your budget line items. I'm going to make one last call for questions.
Okay, just to confirm, that means you will not fund projects that touch on substance abuse disorders, even if it is increasing access to treatment for such populations?
I would encourage the agency asking that question. It's hard to answer that question blindly, to not know what agency is presenting that question and or what type of facility or other services would be presented in that grant. All I can say again and reiterate is that this LOI, call for LOIs, focuses on access to health and capacity building. We did have a over $1 million LOI process last year that made a call for mental health, including substance abuse projects, and we will be continuing funding for many of those projects based on the reports, further interim reports to come in this month, making invitations to those agencies. So our commitment to mental health and substance abuse continues, as will our investment of significant dollars within that body of work and portfolio. I would encourage all those on the webinar or that are looking at the RFP or view this webinar or slides moving forward to just know that this cycle in particular, with the breadth of opportunities and interest around social determinants of health, capacity building, health equity, and access to care, that there will be a lot of projects presented to us we're anticipating. So yeah, that's all I have to offer. That agency or agencies can feel free to sign up for office hours and make their case, perhaps. But yeah, I think I'll leave it at that for now. Any other questions, anyone? Okay, I don't see any other questions coming in. Kukwa, one last call from your end?
Nope, I have nothing.
Great. Again, here is the link to Fondant. Agencies that have created a login before can just use that login. The LOI portal is open. You can begin working on your LOIs. And again, we will continue to monitor the doodle for the demand on the office hours. Again, we have 3 open sessions still on Tuesday and Thursday that can be reserved. Those sessions can be done either over the phone and or in person here at the Foundation offices. And we will consider opening up more slots once those 3 are filled. Happy New Year to everyone, and thank you for joining us this afternoon. And again, these slides will be sent out, and this recording will be posted on our site. Happy New Year, and have a great weekend. Thank you.